A presentation slide with video chat thumbnails on the right. The slide is topped with a header and logo, NIH, National Institutes of Health, Office of Nutrition Research. The header has various charts and graphs overlaid on top of vegetables. There is a picture of a brick building with columns in front in the lower right. Slide title, Background, NIH, Text, NIH Mission, to seek fundamental knowledge about the nature and behavior of living systems and the application of that knowledge to enhance health, lengthen life, and reduce illness and disability.
NIH has 27 institutes and centers, or ICs, which provide funding. Some are the majority extramural, some intramural programs, with the goal to conduct research studies on nutrition and how it relates to human health and disease. NIH also supports biomedical and behavioral research and training in nutrition as it relates to human health, disease prevention, and treatment. Next slide, please.
Slide, Background, Prioritization of NIH Nutrition Research. The blue cover of the 2020 to 2030 Strategic Plan book for NIH Nutrition Research is on the lower right. It features scientists in a lab. Text, NIH has been bolstering nutrition research because of the role that nutrition plays in health and disease.
So given the important role of nutrition and health, in May 2020, NIH announced the first agency-wide plan for NIH nutrition research. And the main goal for this plan is to advance nutrition science and address diet-related diseases across the lifespan. The strategic plan, we call it SPINNER, is organized around a unifying vision of precision nutrition. And this is important because there has been an increase in scientific and public interest in precision nutrition and how personal health, environmental exposures, diet, genes, the effect of microbiome, all are interrelated. And then the goal is to discern what or tease out all these specific components and how we can improve precision nutrition for the general public. Next slide.
Slide, Precision nutrition is the overarching theme with multiple strategic goals and cross-cutting research areas. A graphic of 4 overlapping circles labeled from left to right as 1, 2, 3, and 4 appears. Smaller yellow circles labeled cross-cutting research areas are on the edges of the 4 large central circles, and dotted lines zigzag through the large circles to connect the smaller ones.
So as I mentioned, precision nutrition is the overarching theme of the strategic plan, and it includes 4 strategic goals, which are listed in the circles. So expert discovery, innovation through foundational research, investigate the role of dietary patterns and behaviors for optimal health, define the role of nutrition across the lifespan for healthy development and aging, and reduce the burden of disease in clinical settings. These goals had also cross-cutting research areas, which are the dots that are in the figure. And these are cross-cutting research areas that overlap the different strategic goals. Minority health and health disparities, health and women, rigor and reproducibility, data science, system science, artificial intelligence, and training in nutrition scientific, the nutrition scientific workforce. And all of these areas complement and enhance ongoing research across research efforts on nutrition across the NIH. Next slide, please.
Slide, Background, Prioritization of NIH Nutrition Research, continued.
So recognizing the importance of nutrition research as a strategic priority for the whole NIH, in January of 2021, the NIH director, at that point it was Dr. Francis Collins, announced the transfer of the Office of Nutrition Research from one of the ICs, NIDDK, to the NIH Office of the Director. And this is an important move because it was placed within the Division of Program Coordination, Planning, and Strategic Initiatives, given the importance of nutrition as a strategic component for NIH mission. So the goal of DPKIPSI, the division, is to identify emerging scientific opportunities and rising public health challenges and knowledge gaps.
Text: identify existing knowledge gaps that deserve special emphasis and would benefit from strategic coordination and planning.
Nutrition research is aligned, as I mentioned, with the scope of this mandate and the mission of the Division of Program Coordination, Planning, and Strategic Initiatives. Next slide.
Slide: ONR mission.
So that's ONR mission is to advance nutrition science to promote health and to reduce the burden of diet-related diseases and nutrition health disparities. And well, to this end, ONR has key responsibilities such as coordinate implementation of the strategic plan for NIH nutrition research, identify research topics that deserve expanded effort and support by all the different NIHICs and offices, coordinate trans-NIH nutrition research projects in cooperation with the ICOs, represent NIH on intradepartmental or interagency committees on nutrition research and related policy issues, and advise the NIH director, the Poughkeepsie leadership director, and other leaders, and other important interested groups on the matters related to nutrition research. Next slide.
Slide: ONR mission, continued. A figure on the right is titled, Strategic Plan for NIH Nutrition Research. Implementation Working Groups. A green circle in the center is labeled ONR, around it are 8 colored ovals each labeled with a working group.
So to implement the strategic plan, ONR has established 8 topic-based implementation working groups. We call it IWGs, comprised of NIH nutrition subject matter experts, which is different NIH staff that have expertise in different aspects of nutrition research from across the ICOs. And so these are, as we see in the figure, the IWGs that we're currently formed and working on implementing the strategic plan are diversity, equity, inclusion, and accessibility, nutrition and health disparities, nutrition across the lifespan, approaches, methods, and tools for nutrition research, medical nutrition, implementation programs, microbiome, diet, and health interrelationships, and foundational nutrition science. So each of these IWGs is charged with advancing the priorities identified in each of the strategic goals and cross-cutting research areas I mentioned before, and also catalyzing nutrition research at NIH-funded universities and institutions, and also for NIH intramural groups. Next slide.
Slide: NIH Nutrition Research Report 2020 to 2021. On the right is a blue title of the report featuring a group of vegetables. Text: NIH is the leader in federally supported nutrition research and training.
So earlier this year, ONR released the biannual NIH Nutrition Research Report for fiscal years 2020 to 2021. And this report highlights the total federal support for nutrition research for fiscal years 2019, 2020, 2021. And NIH provided a total of $1.92 and $2.1 billion respectively for these efforts. And these amounts represent the combined individual contributions of 24 NIH ICs and also the NIH Office of the Director. In fiscal year 21, for example, NIH supported approximately 2,000 nutrition-related clinical studies in 50 states, the District of Columbia, and 2 US territories, and 19 foreign countries. Next slide, please.
Slide: NIH Nutrition Research Report, continued.
So in this report, we also show that different, just a summary of the funding for NIH and as a spending category. And just to mention some, as a percentage of the total NIH spending, funding for nutrition research and training has been stable approximately at 5% since fiscal year 2015.
A table at the bottom has 5 columns titled Fiscal Year, Nutrition Research and Training, Current Dollars, nutrition research and training, constant dollars, actual total NIH obligations, and constant nutrition dollars as a percentage of actual total NIH obligations. The three rows included are 2019, 2020, and 2021.
However, as we see in this table, since fiscal year 2019, the total amount of NIH spending on nutrition research and training has been decreasing. And you can see that at the last column of the table. For the constant nutrition dollars as a percentage of actual total NIH obligation, the percentage has been decreasing over the years.
The percentage drops from 4.9 to 4.6, then 4.3.
So I think I will stop here and I will pass the baton to my colleague, Nicholas Jury, who will talk about ONR activities.
Thanks so much, Roberto. That's very informative, and thank you for opening the presentation. I'd also like to thank ODS for inviting us here to come talk about all the things that ONR is doing nutrition research at NIH.
Slide, ONR activities, research planning and strategic initiatives.
So I'm going to be talking to you today about just different activities that ONR is involved with, different research planning and strategic initiatives. As Roberto mentioned, ONR coordinates NIH-wide activities on nutrition research. Here I'm listing just a few of them. One of them is a training program to equip the next generation of nutrition science researchers. The Advanced Training in Artificial Intelligence for Precision Nutrition program.
Text, RFA-OD-22-027.
And this program emphasizes diversity not only in trainees and in faculty, but also in the diversity of topics being discussed. Also, we have a notice of special interest to stimulate research to understand and address hunger, food, and nutrition insecurity.
Text, OD-22-135.
Nutrition and food insecurity are major areas of investigation, especially after the pandemic. They were exacerbated by the pandemic. And we have worked with several other institutes and centers to put together this funding announcement. We have another one that's looking at the different role of transporters in the placenta and the lactating mammary gland to better understand these transporters, how they might be involved in nutrient transport.
Text, elucidation and validation of the role of transporters in the placenta, lactating mammary gland, and the developing gut. RFA-HD-23-003.
We had a request for information on DOHAD, on the developmental origins of health and disease, another area of exploration that ONR is very involved in, looking at exposures in the mother and from birth to 24 months, and looking at not just nutrition, but other exposures and effects on development, and how that may affect later across the lifespan.
Text, NOD-OD-22-157. Slide, ONR activities, research planning and strategic initiatives, continued.
Another activity that we've led and that's very important is we launched a nutrition science data and biospecimen resources portal. And this portal basically queues up in a one-stop shop for being able to access biospecimens, data sets, various data analysis tools and resources for investigators who might be trying to either generate preliminary data for a grant or have other questions, research questions that they would like to dig into the data. And so this website, which is free and publicly available, where investigators can access various NIH-supported and even non-NIH-supported biospecimens and data sets to complement or to research the different questions that they have.
Text, common data elements and measures, data analysis tools and resources, repositories for data and biospecimens, research study query and reporting tools. Slide, ONR activities, research planning and strategic initiatives, continued. Text, ONR has also hosted virtual workshops to obtain input on important issues on nutrition research.
Some other activities that I will mention here, we had a couple of workshops. Obviously, one was on food security, nutrition, and health disparities. And another one we had was on malnutrition in clinical settings, which is another issue that seems to be coming to the forefront on how we can better identify and address patients who come in who are malnourished, and trying to keep them on a protocol that is ideal for their recovery and also for their, for preventing them from being readmitted into the hospital.
Text, co-organized with ASN Medical Nutrition Council, Aspen, and in leadership.
And then we were also involved in nutrition as a prevention for improved cancer outcomes workshop as well.
Slide, ONR activities, research planning and strategic initiatives, continued.
Two of the other areas that are currently undergoing are the Food as Medicine Networks and Centers of Excellence Initiative, which is a initiative that's under development in collaboration with 11 other federal agencies, and is part of a whole of government approach to end hunger, improve nutrition and physical activity, and reduce diet-related diseases and disparities. Again, there's no funding announcement for this particular initiative yet, and it's under development. But we do have an RFI that we put out, which I'll talk about a little bit later. One of our key programs that we are involved with is the Nutrition for Precision Health study, which is an ancillary study that is embedded in the All of Us research program. And it's designed to implement the aspects of the strategic plan about how individuals respond to different diets. And ultimately, what we're hoping comes out of that study is just different algorithms that may be able to predict different responses to food and dietary patterns based on your microbiome, your age, genetics, metabolomics, several different factors, to collect this data and be able to inform a more tailored type of diet.
Text, this high-quality nutrition study will help individuals and their healthcare providers create healthy, precise, and effective diet plans. Slide, logo, Food as Medicine. Networks or Centers of Excellence. On the right is a chart with 4 quadrants titled Research, Education, and Training, Patient Services, and Community Outreach and Engagement.
Pivoting back to the Food as Medicine, as I mentioned, we've released an RFI on the Food as Medicine research opportunities with 11 other federal agencies, 13 other NIH institutes, centers, and offices that have signed on to the RFI.
Text, NOD-OD-23-107. 6 DPCPSI offices, OAR, ODP, ODS, ONR, ORWH, THRO.
The program really is going to emphasize 4 main components: research, education and training, patient services, and community outreach and engagement. The vision for the program is basically a nexus to the healthcare system and brings nutrition more into the forefront. So doing food insecurity assessments and figuring out, if people need medically tailored meals or produce prescriptions, and trying to implement that into the health system and into the community together, while also improving education and training, nutrition training for providers in the healthcare system. And then obviously the main component is researching how these particular services and trainings affect health outcomes and whether they can provide the evidence for increased reimbursement for these services by insurance.
The research quadrant reads, Interventional, Behavioral, and Implementation Studies on the Efficacy and Healthcare Economics of Food as Medicine Services or Activities to Address Food Insecurity, Disease-Related Malnutrition, and Chronic Conditions. The Education and Training quadrant reads, Expansion of Clinical Nutrition Training for Health Professionals, Medical School, Word obscured by video chat thumbnails, and Nutrition Fellowships, Inclusion of Culinary Medicine and Teaching Kitchen Programs. The Patient Services quadrant reads, Expand food insecurity and nutrition status assessments and, where needed, provide food as medicine services. Examples include, medically tailored meals or groceries, nutritious food referrals, produce. Prescriptions. The Community Outreach and Engagement quadrant reads, Partner, engage, and communicate with communities to improve health and reduce diet-related diseases.
Our director, Dr. Lynch, actually released a perspective piece on the concept in the American Journal of Clinical Nutrition. You can check that out if you'd like.
Text, A Concept for Comprehensive Food as Medicine Networks or Centers of Excellence, Christopher J. Lynch, Ph.D., Acting Director. https://www.sciencedirect.com/science/article/PII/S0009165234738332 via %3DIHUB, slide, Food as Medicine Networks or Centers of Excellence. Text, Program Deliverables, Addressing Diet-Related Chronic Diseases and Nutrition Disparities. Evaluation Metrics to Accurately Measure Effects or Root as Medicine Interventions. Profiles of people who will benefit from different types of food as medicine interventions. Evidence-based to inform policy changes by the healthcare industry, insurers, and policymakers. Annual meetings convened by ONR to showcase study investigators, innovations within health systems and communities, and regionally appropriate and culturally sensitive food as medicine best practices.
Overall, the program, what we hope would come from it is not only addressing the diet-related chronic diseases and nutrition disparities, but providing the evidence base, to inform policy changes in the healthcare industry. If we're improving health outcomes through these food as medicine approaches, we want to disseminate that as widely as possible. And I would think that insurers and payers would be interested in these types of outcomes.
Slide, Developmental Origins of Health and Diseases, DOHAD. A chart titled, Exposures Over Time Can Affect Future Disease Risk, shows a man and woman labeled mother and father in a circle on the left. An arrow points to a pregnant woman on the right, labeled gestation. Further to the right are illustrations of the offspring at different stages labeled infancy, childhood, adolescence, adulthood. Below the mother and father are circles with bacteria labeled mother's microbiome, brown bacteria, and father's microbiome, light blue bacteria. Underneath the child's life stages is a stretch of brown, light blue, and dark blue bacteria labeled child's microbiome.
One of the other major programs that we're working on, which is again an initiative that is in development, is the Developmental Origins of Health and Diseases. There is talk that obesity is, doubling, tripling, quadrupling in our younger kids, our adolescents, and young adults. And there's thought that this is getting programmed or imprinted earlier on in life based on exposures. And so this program will include human milk composition, dietary intake, nutritional status measures and outcomes to try to really get at the mechanistic questions of this DOHAD hypothesis. And we'll investigate all across, early life. We'll try to get birth to 24 months data and address that very critical period of development, as well as maybe later on and across the lifespan.
Text, ultimately, lead to optimized diet for health of mother and child. Transformative research program examining role of diet, food environment and related environmental exposures on developmental origins of health and diseases. Responds to increasing concern that food environment, life stress, traumas, medications, health and nutritional status, microbiome ecology, and related environmental exposures are responsible for risk or future diet-related disease. Slide, Expansion and Diversification of the Nutrition Science Workforce.
Another initiative that we are really proud of is an expansion and diversification of the nutrition science workforce. And as I mentioned, the advanced training program earlier, that's just one component of this goal. We've actually stood up a DEIA nutrition science implementation working group, which Roberto was talking about, which is going to focus exactly on increasing training, mentoring, and career development and networking to expand diversity of the nutrition workforce. And also look at just different novel research projects and cross-disciplinary research programs.
Logo, White House Conference on Hunger, Nutrition, and Health. #WHConf Hunger Health.
Another major thing that we were involved with last year was the White House Conference on Hunger, Nutrition, and Health. This is a once in the 50 years conference that really brought a lot of thought leaders together, not just from across the government, but from all across nonprofits, the private sector, to tackle hunger and diet-related chronic diseases and the related health disparities. And our office was very involved in that effort.
Slide, Conference Goal.
And the goal is to increase end hunger, increase healthy eating and physical activity, and reduce the related disparities by 2030 so that fewer Americans experience diet-related diseases like type 2 diabetes, obesity, and heart disease. Certainly a very ambitious goal for the administration.
Slide, National Strategy on Hunger, Nutrition, and Health.
Out of that conference came a national strategy on hunger, nutrition, and health. And that strategy basically are the cross-government commitments that the different agencies have made to try to reach the goal of the conference. And it is around 5 different pillars. There's the pillar to improve food access and affordability, integrate nutrition and health, empower all consumers to make and have access to healthy choices, support physical activity for all, and enhance nutrition and food security research, which is primarily where NIH comes in since we are a research agency. And included were these commitments and priorities to try to really galvanize this whole of government approach.
Text, priority legislative proposals and a call to action for private sector, local, state, tribal, territory governments, philanthropy, civil society, and other partners. Slide, some NIH commitments on the national strategy. Text, food as medicine networks or centers of excellence. Leverage Compass Program, Common Fund Program. Leverage NIH Climate and Health Initiative, NIH-wide. Support advanced training in alpha precision nutrition science. Stimulate research to understand and address hunger, food, and nutrition insecurity. Determine the role of diet and other early life exposures in health and disease, DOHAD. Measures/methods, 24-hour patterns of diet, physical activity, and sleep. Research interplay between nutrition, oral disease, and comprehensive health.
Just including some of the commitments in the national strategy from NIH that were included, many of which we have already spoke about. There's this interesting one about leveraging the Climate and Health Initiative, which has been an ongoing project by NIH for a while, but the White House wanted to specifically include.
Photos of speakers at the conference, including President Biden, and selfies of participants.
Just some pictures of us at the White House conference that I wanted to share. The president came and spoke and really just gave us the charge of trying to meet the goals of the conference and really advance health and improve nutrition and physical activity for all Americans.
Logo, NIH, National Institutes of Health, Office of Nutrition Research. Text, thank you. Questions?
And with that, I will end there and we will be happy to take questions.
The presentation slides close. The screen fills with the video chat windows of the participants, most of them blacked out with only a name visible.
Thank you, Nick and Roberto. That was great. Let me see. Questions. Okay, first question. Is there a simple answer to the question, what is the key difference between NIH ONR food as medicine and precision and the precision nutrition programs?
Yes, and that's a great question. I'm glad you brought that up. So the Nutrition for Precision Health study is an already established study and it is ongoing. And its primary goal is to determine how people react to different diets and trying to develop those algorithms so we can really try to truly have precision nutrition, which, you go into your provider, they take, some blood samples, they take some other points of data, and then they plug it into the algorithm, and then a certain diet would come out, right? I mean, obviously it's not going to be perfectly like that, but that is part of the goal of the NPH program. And the NPH program is embedded in the All of Us research program, which is this large cohort where the NIH hopes to recruit over 1 million folks and take just basic baseline data on them. Whereas the food as medicine approach is taking these food as medicine services, so produce prescriptions, medically tailored meals and things such as that, and then implementing that into the healthcare system through a community outreach and engagement strategy, and also improve training for providers. So that's how those two topics, and that's also an initiative that we are hoping Congress this year is going to appropriate the funding for. So we don't even have a funding announcement ready for that, but we do have an RFI. So if you want to provide any input on that particular topic, we would welcome you. And I can put that in the chat if you'd like as well.
So just to complement the information about the Nutrition for Precision Health, this is a very well-defined study that has 3 modules. And the first module is just a cross-sectional study to determine, based on their habitual diet, what are the biomarkers that can be identified in the population, and then try to see if there are any algorithms that can be developed through machine learning and AI to understand the relationships of nutrients or diets and biomarkers. And then there are 2 other modules, module 2 and 3, which are more nutritional intervention. This is more defined, smaller, nested studies within the Nutrition for Precision Health, where individual diets are going to be assessed for a short period of time. They're not linked to any health outcome per se, but it's more to study longitudinally how these changes may be predictive, or if there are any biomarkers or combination of for predicting nutrition status.
Great. Thank you, Nick and Roberto. I have a question, and you pointed out in the most recent nutrition research report that funding for nutrition has been going down, and yet on the other hand, funding interest in nutrition research has been going up across the board, it sounds like, not just NIH, but all federal agencies of the White House. So that's sort of a strange juxtaposition. And any ideas if are there money coming from other places or other federal agencies kicking in? Where is the funding coming from for these big initiatives that are, and all of this interest?
So I'm glad you raised that, Karen, actually. So the funding, the reason why the funding is going down as a percentage of total obligation is probably because of inflation. That's one of the things. So that the dollar amounts are going up, but the effective buying power is going down, right? And actually the total dollar amount has almost been flatlined for the last several years. But you're right. I think that you're seeing collaborations in other federal agencies who are kicking money in. One of the things that came out of the White House conference were these external commitments. I think so Rockefeller, Kroger, and AHA committed $250 million to one of their pilot projects for food as medicine. I see another food as medicine comment or question in the chat. So it's the question said, so simply said, food as medicine is a reimbursement program by private and public entities. Not exactly. So food as medicine are services. So whether it's medically tailored meals for someone who gets them, for a particular disease or condition, produce prescriptions, and some things like that. In some states, there are Medicaid is, they do have waivers and they're paying for some of these things because, produce and some of these things are very expensive. And so it's not wide across the country. And these are just kind of, I guess, for lack of a better term, demonstration pilot programs to see if they're going to improve health and things such as that. But basically, the goal of the food as medicine, the ONR food as medicine program, will hopefully be to develop to see if these approaches do improve health outcomes, and if they do, provide the evidence for payers and insurance to determine if they're going to, reimburse for them, because a lot of providers don't get reimbursement or paid for these types of things.
So will there be any implementation science research as part of this whole big extravaganza of nutrition research?
Yeah, I'm glad you actually said that. Implementation science is actually the research component part of it, that diagram that I showed of the 4 different things that are going to be incorporated for the program. That's the hope anyway. Again, this is a new program. We're still waiting for Congress to appropriate the funds for it. And we have the RFI out as well. Yes, fingers crossed.
Okay, great. If there are no other questions for Nick and Roberto, we can move on to our next speaker. And there'll also be a chance at the end to talk to any of the speakers. So our next speaker is Dr. Patricia Haggerty. She's the director of the grant funding program in the Office of Dietary Supplements. In this capacity, she manages the ODS grant and co-funding program, which allows ODS to promote and share the costs of dietary supplement related research with NIH institutes and centers. Patricia also develops partnerships and collaborations with NIH ICOs on extramural research funding and initiatives of high priority to the NIH and to the ODS. And for more detail, you can click on her name in the bio. Patricia?
Okay, thank you, Karen. I'm gonna share my screen now. Okay.
Slide, NIH/ODS support for dietary supplement research and training. Text, Patricia A. Haggerty, PhD, Director, ODS Grant Funding Program. Dietary Supplements Research Practicum. May 22 to 24, 2023. Logo, NIH, National Institutes of Health, Office of Dietary Supplements.
Okay. Okay, can you see my screen now? My slides?
Yes, it looks great, Dr. Haggerty.
Okay, great, thank you. So good afternoon, as Karen said, my name is Patricia Haggerty and I'm the director of the ODS Grant Funding Program. My presentation is going to be about the NIH and ODS support for dietary supplement research and training. Just a note on the word support here, what that is going to refer to is basically how we fund programs, how we fund the research, so the types of programs, the funding mechanisms, that type of thing. So, so far today, you've heard many things. You've heard about the mission and the goals of the ODS. You've heard about the $60 billion size of the dietary supplement industry and the high prevalence rates of using dietary supplements among children as well as adults. You've heard about the regulatory arena. You've heard about the spinner that was sponsored by the Office of Nutrition Research, and you've heard about the many other activities and priorities of the Office of Nutrition Research. So my talk will dive more into the definition of dietary supplement research, how it is funded by the NIH, and how specifically it is funded by the ODS.
Slide, today's outline.
So my talk is divided into four sections. What qualifies as dietary supplement research? How does NIH fund dietary supplement research? How does ODS fund dietary supplement research and training? And then a little bit about the research priorities for the ODS grant funding program. Okay, so what qualifies as dietary supplement research?
Photos show pills, herbs, plants, and chemical elements.
So Jamie, in the beginning, her talk gave you a little bit of information about this, but so a little bit of repetition here, but that's not a bad thing. So what qualifies is research on vitamins, minerals, herbs, and other botanicals, amino acids, and other dietary or bioactive substances.
Text, as well as their extracts, concentrates, metabolites, and constituents. Not limited to specific health conditions, organ systems or population groups. Slide, what qualifies as dietary supplement research? Pictures on the left show scientists, jars of solutions, a comic strip where the character says, I have one pill that blocks fat, one pill that blocks carbs, and one pill that. And the strip cuts off, and a scientific diagram of the cell.
In addition, all types of research, including basic science or preclinical, clinical, translational, epidemiological research are applicable. And epidemiological studies may be observational, behavioral, and interventional or non-interventional.
Slide, what qualifies as dietary supplement research? Photos on the right show an illustration of vegetables in a cartoon person's stomach and scientific lab equipment.
And lastly, research that builds future capacity for studying the role of dietary supplements in health and disease prevention. In other words, training and career development research.
Slide, today's outline. Number 2.
So now let's talk a little bit about how NIH funds dietary supplement research.
Slide, high-level facts about NIH support for research.
So I want to start with a few high-level points about the NIH and how it supports research. It will sort of set the context for us. NIH conducts research in its own laboratories, and that's called the intramural program, literally inside the walls. And that includes about 6,000 NIH physicians and scientists, most of whom work on the NIH campus in Bethesda. The NIH also supports research by non-federal scientists, and this is all called the extramural program, or outside the walls. And it includes research performed by more than 300,000 individuals at over 2,500 hospitals, medical schools, universities, and other research institutions around the country. So in case you don't know it, the budget in fiscal year 2023 for NIH was $49.2 billion. 84% of that budget is allocated to the extramural program. About 10% is allocated to the intramural program, and a little under 6% goes to overhead.
Slide, how NIH announces funding opportunities.
So how does NIH tell the world about the funding opportunities it has available? How does it announce those opportunities? There's really two main ways, two main approaches. One is the Notice of Funding Opportunity, or NOFO. We love our acronyms at NIH. So this is a NOFO. And a NOFO is a formal announcement of the availability of a funding opportunity from the NIH. It provides information about the award, who is eligible, what the evaluation criteria for applications will be, what are the required components of the application, and how to apply. And you have undoubtedly heard the announcements variously called Funding Opportunity Announcement, or FOA, Program Announcements, or PAs, Request for Application, or RFA. Some of them are parent announcements, and some of them are called solicitations, but they're all under the umbrella of the NOFO. So NOFOs are posted on grants.gov and in the NIH Guide for Grants and Contracts. Another approach, another vehicle, if you will, is the Notice of Special Interest, or NOSI. So a NOSI succinctly highlights a specific topic of interest, specific area of research, or program. It is always connected to a NOFO. So it's a little bit confusing sometimes, but you get used to it. It directs the applicants to one or more active NOFOs for submission of applications for the particular initiative described. NOCs are posted in the NIH Guide for Grants and Contracts.
Slide, types of NIH grants available.
So you might be wondering what types of grants are available through NIH. The short answer is many. We can categorize these grant types into approximately 6 categories. We have the research grants, heard of the R01, of course. There's R21 and R03 and many others, the R series. There's also the career development awards, which are known as the K series. We have research training and fellowship, which are the T and F series. There are program, project, and center grants called the P series. There are resource grants. You might have heard of the R24, R25 educational grant.
Text, various series.
And then there are trans NIH programs. For example, administrative supplements, diversity supplements, the NIH roadmap supported grants. So For a list of all of these activity codes, grant types, I provided the URL here.
Text, https://grants.nih.gov/grants/funding/ac_search_results.htm. Slide, how to find funding opportunities, NIH Guide for Grants and Contracts. A screenshot of the grants and funding page has a menu with filter options on the left and a search bar on the top right. Below the search bar are results.
So if you wanted to find these grant opportunities, where would you go? If you wanted to find current funding opportunities, you would go to the NIH Guide for Grants and Contracts. This is a hyperlink here for the guide. We affectionately call it the NIH Guide.
She indicates the top right of the slide title in blue.
If you go to that site, that web page, you're going to land on a page that looks approximately like this. Here, you can search for funding opportunities according to many, many different parameters and filters. You could just put search terms in the search term box up here. For example, antenatal iron deficiency anemia might be the subject you're interested in, and it would pull up all of the funding opportunities that relate to that particular topic.
She moves to the left menu.
You can also search for funding opportunities over here by the issuing organization. You can search by activity code or by the type of research. There are many other filters. It's just there are too many to put on one slide. Essentially, it's too much information for one slide. The screenshot you see here is what comes up when I clicked on ODS as part of the funding organization, issuing organization, and it pulls up a listing of all currently active funding opportunities in which ODS is involved, collaborating or collaborating with or signed on.
She indicates the second of four buttons on the top right of the search results list. It reads, Export.
You can also do a search and then export your search, this little button up here, into an Excel spreadsheet and save it for later. So it is it's a very user-friendly site.
Slide, how to learn more about NIH research training grants. A screenshot of the website.
Oh, there's another part of the NIH website that I always like to show and talk about a little bit because it's, I think, in my opinion, one of the best sections of the NIH internet. It's like a website in and of itself. It is about all of the research, training, and career development grants available through NIH, and it has the types of grant programs it includes span the spectrum, the career spectrum from undergraduate and post-bac stage all the way to mid-career stage when one might be looking for mentoring or patient-oriented kinds of grants.
5 blocks with arrows on the right span the top of the page. They read, undergraduate and post-baccalaureate education, pre-doctoral training/clinical doctorate, postdoctoral training/clinical residency, early research center development, investigator development, and mentoring. She mouses over the blocks.
Each of these blocks, if you click on any one of them, it's going to take you to grant types and specific grants that are appropriate for that stage in your career. So we can move this bar out of the way. We can basically say that NIH training and career development programs fall under 3 large groups. Those would be the institutional and individual training grants, the individual fellowships, and career development awards, or K grants.
Text, availability varies across ICOs. Check websites. She mouses over a column of blue boxes in the center of the page. They read, career development, research training, fellowship, other training related, and extramural diversity.
These blue boxes in the middle are kiosks. Again, if you click on any one of these kiosks, it's going to take you to a separate page that includes a listing of all of the grants that are within that category. So my last point about this site is that there's so many of these grant types that not all NIH institutes support all of the types of grants available. Some institutes support some, but not others. And you can find the lists of which research training grants are supported by which institutes by going to this URL, this web page linked here.
On the right is an info box titled Research Career Pathways. Below is a link, https://researchtraining.nih.gov/ic-table. Slide, where to find more about funded research, NIH Reporter. A screenshot of the website.
Now, if you wanted to know what kinds of research has NIH already funded, if you have an idea of what your own research area is, and you are curious, you would like to see what has already been funded in that particular area, or you're just interested in an area and wondering what NIH has funded in that particular area, the best place to go is to the NIH Reporter.
She indicates the NIH Reporter text in the right of the title, in blue.
Again, this is a hyperlink under here that links right to the web page. When you go to the NIH Reporter, you're going to land on a page that looks almost just like this.
There is a quick search box with a search bar on the top left. Below that is a bar chart of active projects by institute/center, then an advanced search box with several fields below. In the middle is a map of the USA labeled active funding by state. On the top right is a green box titled, Welcome to the NIH Reporter, with a button on the bottom left for guided tour and bottom right for feedback. Below is a box titled Matchmaker and a button, Get Started. Below that is a box titled Publication Search and a button, Get Started.
This is a very, very nice website. It was completely re-engineered and updated in 2020. You can start by taking a guided tour. It's shown up here in the green box. But if you already kind of know what you are looking for, you can put your terms in the quick search box here. And when you click on search, it will pull up all of the grants that have been funded in the area that you typed in. There are some preset searches, for example, funded research according to the NIH Institute or Center, or what has been funded by the NIH according to the states per state. And then there are many other ways that you can, again, filter a search that you may have through the advanced project search. You can also search for publications that are associated with funded research, with NIH funded research through this button here. This will then search PubMed for publications associated with the particular grant or grants that you will eventually type in, and once you click this box. So this is, again, a very user-friendly and useful site.
Slide, NIH website resources.
So I've mentioned several places and web pages that are part of the NIH website that are good resources for you. They're all listed here, types of grant programs, training mechanisms, activity codes, and so on, as well as their URLs for you to use later.
Text, types of grant programs, https://grants.nih.gov/grants/funding/funding_program.htm. NIH training mechanisms, https://grants.nih.gov/training/extramural.htm. Full list of activity codes, https://grants.nih.gov/grants/funding/ac_search_results.htm. NIH Reporter, https://reporter.nih.gov/. NIH Glossary, https://grants.nih.gov/grants/glossary.htm. NIH Guide for Grants and Contracts, https://grants.nih.gov/funding/search guide/index.html. Slide, today's outline, number 3.
So now let's talk a little bit more about how ODS funds dietary supplement research and training.
Slide, ODS funding strategies.
Basically, ODS has many programs for supporting dietary supplement research, and you've probably gleaned that by now today. At a very high level, the way ODS funds research falls into 5 main buckets, as shown in this slide.
5 colored boxes are on the slide.
It is essentially the types of requirements and the financial instruments used that differentiate these buckets. So we've got participation in extramural research funding initiatives. We've got extramural research project co-funding. We have interagency agreements, in other words, agreements with some other federal agencies like the FDA or USDA. We fund some intramural grants, as Ricardo mentioned in his session. And then we have some contracts, which are essentially contracts for research services.
Slide, ODS grant funding program, partnership and collaborations.
But I'm focusing here on the program that's under my bailiwick, which is the grant funding program. So, and the next few slides are going to be about the grant funding program in particular. Like most other NIH offices, ODS does not have authority to fully fund or administer NIH grants. Only the NIH institutes can do that. However, we have a variety of ways that we can contribute to the costs of a grant. We participate in the funding initiatives of other NIH institutes, centers, and offices, or ICOs. We co-fund grants, and we have administrative supplements.
Text, ODS shares in funding of grants assigned to other ICOs. ODS funds add-ons for DS research to existing grants.
All of this requires that we develop good partnerships and collaborations with our NIH colleagues across the ICOs.
Slide, participation in extramural funding initiatives. Text, principles/strategy.
So a few words about our participation in extramural funding initiatives. How do we choose the ones that we choose to participate in? Well, there's some principles and a strategy, I would say, and it is as follows. So first, we must identify initiatives where dietary supplement related research may be relevant. That's obvious, right? That's sort of an obvious statement. We also want to recognize if and where ODS may have a role or influence. Now, not all initiatives are the same. There may be some funding initiatives where dietary supplement research is relevant, but it may be a small part of that particular initiative if the initiative is very broad. There may be other initiatives where the relevance and possibilities for dietary supplement research are greater. And in those kinds of initiatives, we may even contribute language to the NOFO as it's being developed to explain and elaborate a little bit on the particular areas of interest that we have in that initiative. So we want to collaborate with other NIH ICOs that have shared interests. Again, seems kind of obvious, but what it means is that we identify the other NIH institutes and centers, offices that have some shared interests with us. And we look at those and say, okay, let's, we're going to pay attention to the initiatives that they are developing or have put out, because we know that we have some common interests. We also think it is important to support our partner NIH nutrition offices and institutes and trans NIH initiatives where possible. and some of the more frequent partners that we have are the Office of Nutrition Research. I consider that a sister nutrition office. The Office of Disease Prevention. Certainly there's a lot of a shared interest space between the ODP and the ODS. We have several collaborations with NICHD, that's the National Institute of Child Health and Development. And then we have a very large and significant partnership with the National Center for Complementary and Integrative Health, primarily over the area of botanicals. And last but not least, we look to see if by our collaboration and participation, we might be able to strengthen these initiatives, both financially and synergistically.
Slide, how to learn more about ODS grant funding program. A screenshot of the website, https://ods.od.nih.gov/. It has a banner on the top left, thumbnails to content in a grid below, and a news column on the right. A box points to both a tab above the banner and a thumbnail box that read, Grants and Funding. Text, Grant Funding Program, https://ods.od.nih.gov/funding/grants-and-funding.aspx.
So if you'd like to learn more about the ODS grant funding program, I'm going to show you how to do that. If you go to the ODS website page, the website, this is the URL to the ODS website, you could get to the grants funding program through either clicking on this tab up here. It's very small, I know on the slide, but when you're on the website, it's not small, it's easy to see. That says grants and funding. And on the bottom of the landing page for the ODS website, there's a section that looks like this, and you'll see in the center the grants and funding program here, and you can click on that and it'll take you to the web page that has more detail on that. The actual URL for the grant funding program is here.
She indicates the second link listed. A screenshot of the grants and funding page has a picture of a column patio on the top left, headers and a paragraph for the opportunities, and announcements on the far right.
And when you go to the grant funding program web page, it looks like something like this. It has all kinds of information on it, and I'm going to point out a few pieces of that, but not everything.
She indicates a box to the right of the picture, then the one below.
So there's a box here that will take you to yet another page, and this is about the ODS co-funding program. There's also a box here. If you click on these titles, they're going to take you to another page on the internet. Going to take you to, you're drilling down basically to more information. This box here will take you to a listing of funding initiatives we are currently participating in. And I actually showed you that on an earlier slide.
She indicates two link headers within one box halfway down the page.
Here, you can click on either of these to see the administrative supplement offerings we have. And then if you're a researcher involved in your main interests are natural products and botanical research, there's a nice page that you can go to where we've included a number of resources for investigators in this arena.
A screenshot of the ODS co-funding program landing page. It includes a table of contents, overview, and types of research that may be co-funded on the left and announcements on the top right. A website URL is obscured by the video feed thumbnails.
Now, this is our new website page that goes further into depth about our co-funding program. It is I don't expect you to be able to read this on the slide, it's too small, but this is a screenshot of the web page. It explains, it gives you an overview of what we co-fund and what the parameters are for co-funding, the types of research that may be co-funded, and further down the page, which is not here, but you would see it on the actual web page, are instructions for how to submit requests for co-funding. And I do want to point out that Co-funding requests cannot be made by the applicants themselves, by the PIs themselves. Co-funding requests are made between institutes. So another NIH institute or office would make a request to us for a co-fund that maybe that would apply to a grant application that they had received.
Slide. How does ODS support training in DS research?
And so I also wanted to talk with you today about the ODS support for training in dietary supplement research. We have a few programs. One program that is very much appreciated by the intramural scientists is our ODS Research Scholars Award program. And that began in 2014 and is a collaboration with the NIH Intramural Research Program. It targets early career intramural scientists, and they must have an assigned mentor and at least 1 year postdoctoral research experience. And they must propose research on dietary supplements or their ingredients. These awards are designed for projects that can be carried out in a short period of time with limited resources. The awards are limited to $100,000 and for 1 year.
Slide. ODS Research Scholars Program funded applications by NIH institutes and centers, 2014 to 2020. A pie chart lists applications by institute and percentage. National Eye Institute, 2%, National Institute on Aging, 2%, obscured by video feed thumbnails, 23%, National Institutes of Dental and Craniofacial Research, 5%, National Institute of Environmental Health Science, 9%, National Institute of Arthritis and Musculoskeletal and Skin Diseases, 2%, National Cancer Institute, 16%, National Heart, Lung, and Blood Institute, 14%, National Institute of Diabetes and Digestive and Kidney Disease, 16%, National Institutes of Alcohol Abuse and Alcoholism, National Human Genome Research Institute, 2%.
This is a graphic that I won't spend too much time on, and you will be able to look in more detail at this if you look back at the recording or the slides, but it shows the distribution of institutes with whom we've partnered for ODS Research Scholars Awards. We've awarded awards to early stage intramural investigators in all of these labs, many of them, about 12 or so here over the last 8 years. And we continue to reach out to the ICs and their laboratories in the hopes that we can continue to maintain and grow this program.
Slide. How does ODS support training in DS research? A book cover is blown up on the right and part of the title is missing. The legible section reads, Dietary Supplement, Research Practicum.
We also support the NIH Training and Career Development Grant Series that I mentioned to you before, mainly through co-funding, and those would be institutional training grants, fellowships, career development awards. Since 2001 through to 2022, we've supported 167 of these types of grants, and we would like to grow that number. Last but not least, there are training programs in other sections of the ODS, like the one that you're sitting in now. This is the Mary Frances Picciano Dietary Supplement Research Practicum that we've held every year since 2007. And it is a multi-day course that includes presentations, discussions on various topics related to dietary supplement research.
Text, issues, concepts, knowledge gaps, and controversies pertaining to dietary supplements and their ingredients. Target audience includes academic faculty, PhD students, postdoctoral fellows, healthcare practitioners, and other professionals with advanced biomedical degrees.
And we trust you're enjoying it so far, and we believe that you will be getting a lot out of it by the time it is over.
Slide, today's outline, number 4.
So the last part of my talk is about the research priorities for the grants funding program.
Slide, Grant Funding Program Research Priorities. A graphic at the bottom shows a pregnant woman, then an infant that ages to an adult then shrinks down slightly as an elderly adult. On the right is a book cover titled, Chronic NCD of Middle Age.
So I've listed some research high priority research areas for the grant funding program. And I want to take note for you that these priorities would not necessarily apply to or aptly describe all programs within the ODS because of their purpose. The purpose of some other programs within ODS is very different. For example, the analytical methods program or our dietary supplement ingredient and label databases. They have different kinds of purposes, so and other programs as well. But in the grants funding program, identifying research priorities helps us make decisions when funding becomes limited and we must choose between, say, equally meritorious requests for support, but that we don't have funding to support them all. And it also helps inform our NIH partner ICOs when they are considering what co-fund requests they are going to make to us. So the research priority areas include, but are not limited to, dietary supplements or their constituents and their mechanisms, functions, or roles in nutrition across the lifespan, especially pregnancy, lactation, infancy, childhood, and aging. Nutrition related to chronic or non-communicable diseases of middle age, indicators and markers, biomarkers of nutritional and micronutrient status, and the microbiome in nutrition and health. So, thank you for your attention, and I'd be happy to take any questions.
Logo, NIH, National Institutes of Health, Office of Dietary Supplements. Text, thank you. Contact ODS, https://ods.od.nih.gov/about/contact_us.aspx, Patricia Haggerty, PhD, Director, Grant Funding Program, Office of Dietary Supplements, National Institutes of Health. Mobile, 301-529-4884. Email, patricia.haggerty@nih.gov. The screen again fills with video feeds, mostly black with names.
Thank you. Thank you, Patricia. I have a question here. Okay, your first question. If a grant application relating to nutrition and dietary supplements is close to the funding line, is there a way to get ODS to take a look? And is there a specific PO to contact before a resubmission to be considered for ODS initiatives?
Thanks, Karen. That's a very good question because that's a very typical scenario. As I mentioned, ODS does not have the authority to fully fund a grant, but we also do not have the authority to be named as the primary administrator for a grant. So a grant like that, an application like that would have been assigned to another NIH institute that does have full funding authority. And it's that institute that's going to make the request to ODS for co-funding. And if the topic matter, the subject matter of the grant application is related to the ODS mission and our strategic goals, then the program officer assigned to that grant application would make a request to us. We have an internal process. And they would make the request to us. So for the applicant, they would talk to their program officer about that. If their program officer doesn't know about the ODS co-funding opportunity, the applicant can mention it to their program officer. And I've showed you where on the ODS website, we have more information about that. And we have no problem with a PI or an applicant pointing their program officer to our website.
Okay, and is that something they could flag their application when it comes in? Just make a note on the application itself that this is related to ODS strategic goal or interest?
There is they could certainly do that. It's not typical, I would say. It's more about the application is more likely to be responsive to the institute's mission, the institute that is assigned to that application or that receives that application. So the topic of the application, first and foremost, is going to be responsive to the mission of that institute. But if the topic then has a relationship to dietary supplements, then it may be applicable for us to co-fund it. So it is, it's dependent upon the institute which receives the application. And they have the first look to make a determination as to whether they want to send it to ODS for a co-fund request. It's got to go through peer review, it's got to get a score, and it's got to meet any other requirements of that primary institution. But then they would make the decision to send it to us to have a look at and to evaluate.
Great.
Sometimes, Kim, I might add, another reason why institutions sometimes look to us for co-fund is that the application might have kind of come near the fence in terms of the score or how it did in peer review. And the topic of the application may not be a high priority for that institution. So they may not be really willing or interested or able to fully fund that application. But if they know or learn or feel that ODS can possibly provide a co-fund, then that takes away some of the financial burden, and that may change the situation for them.
Great, thank you. And we have another question is, next question is, does a small business have to have a relationship with an institution to apply, or can a small business apply directly to ODS grant?
So again, ODS does not directly accept applications, grant applications. A small business grant application, again, would be going to, the term is assigned to an NIH institution. There's a step at which the Center for Scientific Review decides which institution is the best one to get that application. So that application will go to the primary institution administering the grant. There's no reason why we wouldn't or couldn't entertain a request for a co-fund that happened to be a small business grant mechanism.
Okay. And the next question is, can you comment on what study sections that review the proposals submitted to ODS?
So, short answer is no. and the reason is because, again, it goes back to the fact that one cannot submit a grant application directly to the ODS. Grant applications are submitted to the NIH, and then from there, they're assigned to one of the NIH institutions based on what we call referral guidelines. Sometimes it's very obvious where the grant should go. Sometimes a grant will be responding to, say, an RFA issued by one particular institution, and then it's obvious it's going to go to that institution. So applications always go to a primary institution. Then they also go through a peer review process, and those are the study sections I think that individual is asking about. So the study sections may be more about nutrition, or they may be more about the topic of the initiative that the application was responding to. It just depends. And since we don't accept applications directly, we don't have much interaction with those study sections. When we get a co-fund request, the application has already gone through peer review, has gotten a score, hopefully, but always has gotten a summary statement. And so the decision to move an application from the primary institution to ODS for a co-fund request depends in part on how it did in the study section. And it's just, it's too broad of a question really for me to answer specifically on the one hand, but on the other hand, because we don't receive applications directly, we don't have much interaction with the study sections or experience with individual study sections per se. I apologize, I can't answer that one any better, but it's related to the fact that we are not assigned to applications directly.
I think that's a very clear answer. Thank you. I don't see any more questions in the chat. Does anyone else have a question for Dr. Haggerty? And you can always contact her later if you have questions that you are not thinking of now, but that come up later. And both Dr. Flores and Dr. Jury just left the meeting a few minutes ago for another meeting. Okay, well, then it looks like you're going to get 20 minutes of your afternoon back. And we'll see you all tomorrow morning. And tomorrow morning, please go back to the original Zoom link that you were sent with the calendar invitation when you registered. Don't come back to this link. Go back to the original one. And we'll see you at 11 o'clock tomorrow morning. Have a good evening.